We know you've got a ton of questions this morning regarding this decision. So we want to bring in infectious disease epidemiologist and Harvard professor, Dr. John Brownstein. Good morning. Thank you so much for joining me today.
Thank you so much.
So first off, you work at a children's hospital. So what's your reaction to this FDA authorization?
I mean, overall, this is absolutely fantastic news. We're adding 16 million more eligible individuals, kids, into the vaccine mix. This is a super important step to getting children vaccinated. We found that the vaccine, of course, was safe and effective. They looked at this in a couple thousand participants and found it to be 100% effective in kids 12 to 15, meaning no cases of COVID happened in those kids that were vaccinated. Yet those that were in the placebo group, we saw 16 cases. Incredibly safe vaccine. Overall, this is what we expected to happen, but now that it's finally happening, this is going to be so great for our patient population. We deal with the sickest, vulnerable populations, and to get that vaccine to them means so much to them, their health, and also their course of care. So overall, a really great day.
And I've looked at the data. It is really incredible. Some 40%, though, Dr. Brownstein, of parents with kids ages 12 to 15 say they'll only vaccinate their kids if the schools require it, otherwise not at all. So what would you say to these parents?
No, I understand. You have to have a conversation with your pediatrician to fully understand the vaccine. I get it. And we know that there's higher risk in adult populations. That being said, kids do get sick and many have died from COVID. Not only that, we have long COVID and long persisting symptoms. We have the rare inflammatory disease. We know that outbreaks in schools can actually mean a school gets closed. And remember, getting a vaccine means the kids can start to take the mask off, they can start to play sports, play in bands, and also they won't transmit. They won't transmit to those that are more vulnerable. So there's so many reasons to consider getting this vaccine in this age group.
So I'm wondering your thoughts on this. Should schools require students to get vaccinated? And what would that actually do in terms of getting more kids back into classrooms?
Yeah, it's a really good question, and it's going to be state by state. Some states are going to mandate it. I think unlikely we're going to see it out of the gate. And this is all going to be more about encouraging people to get on board with the vaccine. As parents see other parents getting on board, they're more likely. They're going to rely on their social networks, but also rely on pediatrician offices. They're going to do so much of that educating to explain to people why this vaccine is so important, why reducing transmission to community will prevent the spread of variants, but also how important this is for mental health, for anxiety and depression that we've seen in our pediatric population. So getting our kids a normal school experience should be paramount right now.
So I know a lot of parents out there are concerned that, look, I hear you, I see the data, but there's no long-term evidence that this is a good thing for our kids. What do you say to parents who are like, I don't know about the long-term effects of this on my kid's body, it's still developing. I'm confused as to what to do.
Yeah, I mean, we need to look at the history of vaccines. Most of the major events that happen after vaccine happen immediately. And we have so much data on people being vaccinated with the Pfizer vaccine. There's millions of people in this country, tens of millions that have had this vaccine already. Incredibly safe. We've already had it, millions in the 16 to 18-year-old age group. Again, incredibly safe and effective vaccine. And we got to remember that the process for evaluating these vaccines is incredibly in-depth. They look at all the data, they make very strict decisions. And of course, now we have the CDC, their advisory committee. It's an independent group of scientists that are going to look at the data as well. So all the checks and balances are there. There is no indication that this is anything other than a very safe and effective vaccine.
Yeah, I mean, excellent point. You had 16, 17, 18-year-olds getting this already anyway. What does this mean, though, this step, in terms of getting even younger kids vaccinated? I mean, trials are ongoing.
Yeah, no, I think this is an important step because it's setting a precedent for the younger kids to come next. Now, I think it's going to take some time. Pfizer is already working on testing this vaccine in children 5 to 11. So that is probably going to find the data later this summer, maybe approval in September. Now we're moving into the younger age groups, the 2 to 5. That'll probably happen beginning of next year. Moderna is doing some of the same trials right now. We'll probably see lower doses for those age groups. We still don't know exactly. We'll have to see the data. But all indications, again, mean that this is going to be a safe vaccine. And eventually, we're going to get all our school-age kids vaccinated, hopefully sometime in the next coming year.
Dr. John Brownstein, thank you so much for your time and your insight today. We appreciate it.
Thanks for having me.
And I know, parents, this is a lot of information to process. So you can find out more about COVID vaccines for this new age group on our website. That's WFAA.com, or check it out. You can also text the word vaccines to 214-977-6688. 6028, the number there on your screen, and we will send a link directly to your phone.